This is Radio Health Journal. I'm Nancy Benson. This week, why words matter. How language can reduce the stigma of drug and alcohol addiction.
Basically describes them as an alcoholic as opposed to saying this is an individual with an alcohol use disorder.
The healing effect of carefully considered words when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
In Asia, they make rice beers. In the Americas, they made corn beers. In Africa, they made sorghum beers.
The rich history of beer. Then,
if they needed test books, if they needed children's books, if they just needed something to read to distract them while they were stuck at home, we were able to provide that service.
How libraries stepped up during the pandemic. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Words are powerful. They can hurt us or help us. That's why mental health clinicians and addiction specialists at the National Institutes of Health are taking a close look at the language they use every day to describe addiction behaviors. Are the words we use helping patients or causing more harm by creating what's called stigma bias?
Stigma bias being pejorative about a certain condition. In other words, looking down on someone because you consider that condition a moral failure or a failure of choice making or something of that nature, so giving fault to a condition.
That's Dr. George Koob, director of the National Institute of Alcohol Abuse and Alcoholism at the National Institutes of Health. He says that addiction is a medical condition, a disorder of the brain function, not a moral failure. He suggests that labeling someone as an alcoholic, for example, a word most people use, is pejorative. It's a term loaded with stigma bias.
Alcoholic is one that's used frequently, and, it connotes usually a picture of someone down and out, usually unemployed, maybe homeless, who is drinking and getting into a lot of trouble with their drinking and gets into this loop of negativity. They're drinking and therefore they're not a good person, as opposed to saying this is an individual with an alcohol use disorder, which is the terminology we'd like to adopt.
Koob says it's time to sensitize both clinicians and society at large to the words that stigmatize those afflicted with alcohol use disorders.
Drunk is another word that maybe they wouldn't say that directly to a person's face if they're a patient, but, it might be something that you might catch on the side. As they leave the room, they say to another health professional, we got another drunk in there.
The proportion of people with alcohol and drug use disorders who get treatment is less than 10%. Koob suggests that this abysmal statistic is partly the fault of clinicians, who themselves hold stigma biases towards patients with these disorders.
The clinician doesn't think that it is a medical condition. They're going to move on to other priorities, and so they're not going to ask the important question about how much do they drink and what are the implications of how much they drink. And that's another thing that we've picked up on recently, is that clinicians do ask people how much they drink more and more, which is wonderful. But what do they do with that information?
I think a junkie, an addict, those words are utilized in the lexicon very, very frequently.
That's Dr. Nora Volkoff, director of the National Institute of Drug Abuse at the National Institutes of Health. She suspects that for most people, words like addict and junkie are imprinted on our brains. We don't intend to inflict harm by using them.
That person says, well, he's just an addict. What do you expect? Because it's just an addict is just like saying it's just a cancer patient, as opposed to saying it's not just. It is a person and it's suffering from a disease condition, and just to put them a descriptor that in principle entails everything, as if it could entail everything that person is of course extremely demeaning.
Volkoff says we need to learn new terms and practice using them. She compares it to developing sensitivity to racist terms. For example, today you may hear people talk about enslaved persons rather than referring to them as slaves. Volkoff says it's a subtle but important difference. One term recognizes and honors a person's inherent dignity. The other denigrates and offends by labeling a human being as a thing rather than a person. Volkoff believes the same is true of using a pejorative word to refer to people with a drug use disorder.
I think that a very frequent word that is used, he's an addict or she's an addict, as opposed to saying she is a person that's addictive. So you're transforming the individual into the description, as opposed to assigning a person that is suffering from this condition, just like we do with cancer, right? This is a person suffering from breast cancer.
Years ago, as a young doctor on an inpatient psychiatry unit, Volkoff was alarmed when an attending physician refused to treat addiction patients in the emergency department.
So the person, if you are a person that are feeling horrible, you go to the emergency department and they mistreat you, you are not going to want to seek that help anymore in the future. So, of course, no one likes to be discriminated. But if one starts to use language, it's a first step associated with training clinicians of how to properly interact with individuals suffering from an addiction in such a way that those persons don't feel discriminated, that they are dealt with, as we said before. I mean, you need to respect them.
Changing the lexicon, choosing different words, is a place to start. It might be difficult to respect a person who's under the influence of drugs or alcohol, but Koob and Volkoff say that's what clinicians need to do. They need to see the patient and their underlying medical condition and avoid making moral judgments. By using different words, clinicians can reprogram their brains to perceive patients in a new and more respectful light.
And it's interesting how our brain works because, I mean, obviously we create models of reality through language. We communicate with one another through language, and we attach emotions to words.
A lot of the organizations, by the way, are keeping the old terms, including our own for the moment. There are challenges with changing names of organizations. You have to come up with something that will make everybody happy. But we switched to using alcohol misuse rather than abuse.
So, for example, if you've ever wondered whether you or a loved one or a friend might be an alcoholic, you can reframe your question to, do they have an alcohol use disorder?
We think of alcohol use disorder now as a spectrum disorder. And so what that means is you can have a mild, moderate, or severe alcohol use disorder. And I emphasize that because there is a prominent view that you have to hit bottom. That's not the case, okay? People can be getting DUIs and having trouble with their lives, even with moderate alcohol use disorder. Because it's a spectrum disorder, there's a spectrum of treatment.
It'll take some time to change the way we talk about drug and alcohol misuse. But if it reduces the stigma and helps more people seek treatment, Koob says it's well worth the effort. To learn more about alcohol use disorder, visit the NIAAA's Treatment Navigator at alcoholtreatment.niaaa.nih.gov or rethinkingdrinking.niaaa.nih.gov. You can learn more about all our guests by visiting our website at radiohealthjournal.org. Our writer-producer this week is Polly Hansen. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
For those who qualify for Medicare, annual enrollment begins October 15th. Walgreens makes picking a Medicare plan easier. With Walgreens Find Rx coverage, you can explore Medicare Advantage and prescription drug plans to find the right coverage for you. Compare plans online, over the phone, or in person at select Walgreens. Plus, find copays as low as $0 on Tier 1 generic drugs when you choose select plans with Walgreens as your preferred pharmacy. With Walgreens Find Rx coverage, Medicare enrollment is easier than ever. Medicare annual enrollment is October 15th through December 7th. Learn more at walgreens.com/Medicare. That's walgreens.com/Medicare.
An estimated 4.5 million people in the U.S. have chronic liver disease, a number that's growing, according to the National Center for Health Statistics. Up to 80% of people with cirrhosis will develop some form of a condition called hepatic encephalopathy, or HE. HE results when the liver can no longer properly clean toxins like ammonia from the blood, and that can cause a temporary worsening of brain function. Dr. Howard Franklin is Chief Medical Officer at Salix Pharmaceuticals.
Many patients with chronic liver disease, especially younger patients, are not aware that they are at risk for developing HE. So early recognition of the signs is critical. Symptoms can start slowly and may go unnoticed. Look for forgetfulness, confusion, personality changes, slowed or sluggish movements, or slurred speech. In the most severe form of HE, people can become unconscious and enter a coma. If you or a loved one has chronic liver disease, ask a healthcare provider about the risk of HE and guideline-recommended therapy that may help manage the condition.
As the condition progresses, HE can have extremely debilitating effects. During October, Liver Disease Awareness Month, find out more at understandinghe.com. That's understandinghe.com.
Shutdowns during the COVID-19 pandemic contributed to the U.S. plasma supply decreasing by more than 20%. The shortage of plasma could impact many people who rely on life-saving plasma-based therapies. Plasma is used to treat patients with serious diseases and conditions like burn injury survivors, people with rare diseases, and people with certain types of cancer. In fact, 125,000 Americans rely on medication made from plasma. These treatments can mean the difference between life and death for people like John G. Boyle, a patient and health advocate who lives with a primary immunodeficiency disease.
As someone who's received over 1,000 plasma infusions in my lifetime, your donation helps people like me live a normal life. That's why we're calling on everyday heroes to step up and donate plasma now.
Visit donatingplasma.org to learn where you can donate at a center near you. That's donatingplasma.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Basically, we have a lot of choice, a lot of responsibility, and not always all the tools and information to handle it.
Is the average person equipped to make major medical decisions?
Then dealing with migraines.
A lot of people think of a headache as just painful, but when you get severe headaches, it's very debilitating mentally as well.
All that and more on Radio Health Journal.